A few thoughts on medicine, philosophy, and meaning.
Today, I would like to discuss the approach to common problem of bloating. Bloating typically happens in the setting of functional gastrointestinal disease or irritable bowel syndrome. IBS and functional gastrointestinal disease is a fairly common condition, and there is no doubt that diet is very important in management of this condition. One of these regimens is FODMAP. FODMAP are fermentable carbohydrates that when they are ingested, they can create some form of distension and gas because of absorption of a lot of water and creation of gas in the gut. The list of FODMAP is very extensive. I can provide a list in the description of this post, so you can refer to that, or you can search and find the list of food that are rich in FODMAP. But the list includes a lot of vegetables and fruits and very common food like dairy and wheat or bread. Several studies have shown that FODMAP could be helpful in management of patients with irritable bowel syndrome. However, it creates a lot of restriction in the diet. Not only it makes the diet very limited, not all the elements are considered a stimulant in each individual. To add on top of that is the intermittent nature of the symptoms in overwhelming majority of cases. Many of my patients come to me and say that they have symptoms with the same food one day and they have no symptom with that food the other day. So what are the issues with FODMAP that we need to work around and find another better way to manage the symptoms of IBS? Years ago, I came up with the idea of dynamic diet, and there's a book published on that addressed the same issue. Rather than dividing the food into good and bad based on FODMAP, we are creating a dynamic situation because there are many other variables in this equation. One of these variables is amount of food. Many of my patients tell me that they can tolerate 1 spoon of ice cream. They cannot tolerate a bowl of ice cream. The other issue is the combination of food. Some people have no problem with garlic, but when garlic is added to onion, they may have the symptoms and issues. So finding that combination could be very helpful. The other important factor is the bodily and mental status. Many people, when they are stressed out, they cannot tolerate a group of food. And the same group of food has no problem in other occasions. For example, when my patient during exam and finals cannot tolerate coffee, and the same individual can tolerate coffee when they are in vacation. Another important thing is bodily condition. For example, when you didn't have a good night's sleep, when someone is not doing regular exercise for a reason for some period of time, when a woman is experiencing their period and hormonal changes, they may be having the symptoms that they may not have in other period of time. So rather than creating an exhaustive list of the food that are forbidden for you, we are changing the whole perspective into dynamic situation. I would recommend you create a diary of the food, mark your symptoms, and try to eliminate or reduce the amount of food that you consider a stimulant. And I would like you to reintroduce that food in a different time to see if you can have the same symptoms, or this is in the group of food that could be used safely at other time.